Hello, good day. I am student nurse Esther Baguio from 13E Group 17. In this video, I will be doing a return demonstration applying rigid splint. So, a splint is a supportive device used to keep in place any suspected fractured areas such as arms or legs. It is also used to provide relief pain of the fractured limb and to protect the bone from protruding. Also, to facilitate safe and seamless causality transport. Next, first, I am going to prepare the necessary equipment such as the rigid board used to prevent body part from moving. Then, other equipment will be the two triangular bandage, which is used for dressings and used for sling or tie to support the fractured limb. Then the other one is the hand gloves, which is used to prevent blood getting to our skin. Next, we will be going to check if the scene is safe. So, we will be going to check for the unusual noises, sight, the odor, and the appearances. Through checking for unusual noises, sight, and odor and appearances, we will be evaluate that the scene is safe. So, before administering help in an emergency situation, we need to check if the scene is safe. This is to ensure that the safety of our injured patient is safe and ourselves. Next, I am going to get the consent from our patient. Hello, ma'am. I am student nurse Esther Baguio, and I am trained to do the first aid. May I, ma'am? Yes. Okay. So it is necessary for us to get consent from our patient because patients have the right to make informed consent and decision about their health care treatment. So support both below and above the site of the injury. So if you are alone, you can ask the patient to support her arm so that we could proceed to the next procedure. Ma'am, pwede niyo magunitan imuhang under sa elbow, ma'am, sa imong fractured area. Then, this is to prevent further injury and minimize the pain during the splint application. So, next is to check for the circulation, for the feeling, the warmth, and the color, and the pulse of our patient. Ma'am, pwede ni mo lihok ko ni mong fingers, ma'am? Okay. So, nails is pinkish with, check na kayo mong pulse, ma'am, ha? And a good pulse. Ma'am, next is, the patient can feel her arm and move her fingers, which is also in a warm temperature, has a good color with a good pulse, which signifies unimpeded circulation. So, after this, we will be going to place an appropriate size rigid splint or board under the injured part. Pwede gunitan nila. So, after that, this is to provide the amount of immobilization to the affected area. So, we will be going to secure bandages above and below the fractured area. Make sure that when we are going to tie the triangular bandage, it should not be too tight so that the circulation, the blood circulation will not be affected. Ma'am, paki. So, after this one, we will be going to recheck the circulation of our patient, which is the warmth, the temperature, the color, and the pulse of our patient. So, ma'am, pwede pakilihok sa imong fingers, ma'am. Okay, so, and then, ang iyahang Color is pinkish. Ma'am, check na ko imuhang pulse, ma'am, ha? Okay, the pulse is good. The patient can still feel her arm and move her fingers. It is warm and has a good color with pinkish nails and a good pulse, which signifies unimpeded circulation. So, this is to guarantee that the bandages are not too tight to block the circulation. After this one, we will be going to proceed to the nearest hospital or medical facility so that the patient could have a further treatment and serves from other healthcare providers. Okay, ma'am, let's go. And that would be all. Thank you.